If you're over 60 and no longer waking up with morning erections, don't be too quick to chalk it up to age. It's actually a sign your body is trying to get your attention. And ignoring it doesn't just mean losing a bit of spark in the bedroom. It could mean surrendering your confidence, energy, and even heart health. Erectile dysfunction isn't only a sexual issue, it's a signal of deeper problems like poor blood circulation, weakening pelvic muscles, and other internal changes that affect your whole system. But here's what many men don't realize. It's not a life sentence. You can absolutely take control and reverse the trend. My name is Dr. Laura. I'm a urologist and men's health specialist. And for more than 3 decades, I've helped older men regain the vigor and strength they thought was gone for good. In my practice, I've worked with men in their 60s, 70s, and even 80s who've restored their natural erections without relying on medication by applying techniques grounded in real science and tailored to the aging male body. The biggest mistake? Most guys zero in on testosterone or pills, while the real cause goes unnoticed. Today, I'm going to walk you through 4 exercises that boost blood flow, strengthen essential muscle groups, and help revive sexual performance naturally. One of these is so under the radar, most men have never even heard of it, but it's a game changer. Before we dive in, if you haven't already subscribed, I recommend doing so and tapping the notification bell so you won't miss health guidance crafted specifically for men over 60. And if you find this information useful, drop a 1 in the comments or 0 if not. Your feedback is how I continue improving this content. Let's begin with the most fundamental practice and exercise that supports the very foundation of your sexual function, the pelvic floor muscles. Strengthening this area can significantly improve the quality of your erections and your control during intimacy, especially as you age. This exercise is known as pelvic floor activation, more commonly referred to as Kegels for men. I'll always remember one of my patients, 67 years old, newly retired, married for over 4 decades. He sat across from me, voice quiet, and said, "I still love my wife, but I just don't feel like a man anymore." His erections had gradually weakened until they disappeared entirely. Pills hadn't helped. But after 8 weeks of a simple daily exercise I recommended, he came back smiling. "Doctor," he said, "I feel alive again." That exercise was pelvic floor activation. Unlike what many assume, Kegels aren't just for women or for bladder control. For men, particularly those over 60, they're one of the most effective and natural ways to rebuild sexual vitality. Why? Because your pelvic floor muscles manage blood flow into the penis during an erection. When they're strong, they lock blood in, keeping you firm. When they're weak, blood flows out too soon, causing soft or short-lived erections. In my experience, most men have never deliberately trained these muscles, but once they do, the changes are remarkable. Erections become firmer and last longer. There's more control during intimacy, and many even describe feeling more energized and confident overall. The best part? You don't need a gym membership or fancy gear, just dedication and a few minutes a day. Let me walk you through the process. First, find a quiet, private spot where you can either sit comfortably or lie down. The goal here is to locate the right muscle group. The simplest method is to imagine you're mid-urination and then try to stop the stream. That small internal squeeze you feel? That's your pelvic floor working. Be careful not to contract your abs, thighs, or glutes. This movement should come from deep inside. If you place a hand on your stomach and notice it moving, you're engaging the wrong muscles. This should feel subtle but purposeful. Once you've pinpointed the right muscle, contract it and hold for about 5 seconds. Focus on that deep internal pull. Then, release and relax for another 5 seconds. That's 1 rep. Aim to do 10 reps in a row, which takes less than 2 minutes. Ideally, repeat this cycle 3 times a day: morning, afternoon, and evening. After the first 2 weeks, gradually increase the hold time to 7 seconds, then 10. Over time, you'll develop more endurance in these muscles, much like training any other part of your body. After a month or so, many men notice their erections returning with more consistency and strength. Some even report more intense orgasms. It's a small routine, but the rewards for your sexual health can be huge. What's more, this habit gives you a sense of control. You're not relying on a quick fix. You're actively supporting your own recovery, and that's something no medication can replace. If strengthening your pelvic floor can make such a big difference, imagine what's possible when we also address the system responsible for blood flow itself. The next approach involves a simple technique that hospitals often use post-prostate surgery, and it's incredibly effective at home too. It's a practice that can completely reset your natural blood circulation. This brings us to the second method, diaphragmatic breathing combined with pelvic flow stimulation. I often recall one particular patient, a gentleman in his early 70s, who was healthy, active, and still working part-time. But he came to me feeling frustrated and disconnected. "I can't unwind," he said. "Even when I want to be close with my partner, I feel tense, like my mind won't stop racing and my body just doesn't respond." What he described wasn't just mental stress. His chronic tension, shallow breathing, and subtle anxiety were blocking the parasympathetic nervous system, the very system responsible for triggering erections. And what helped him most wasn't a pillet, was a breathing technique. Though it may sound too basic to work, deep belly breathing, also known as diaphragmatic breathing, has a real, measurable effect on arousal, especially in older men. It helps calm the nervous system, allowing blood to flow more freely, and opens the door to a renewed sense of connection both physically and emotionally. As we grow older, our bodies often settle into a low-level state of stress. Muscles stay mildly contracted, blood vessels narrow, and our breathing becomes fast and shallow, often without us realizing. This stress response, sometimes called fight or flight, actually limits blood flow to the pelvic area, exactly what you don't want when it comes to sexual arousal. The good news is that by learning how to breathe intentionally through the diaphragm, you can shift into a rest and digest state. This activates your vagus nerve, helps lower cortisol, brings down blood pressure, and most critically, boosts circulation to the pelvic area. And that's exactly the kind of circulation that supports healthy erections. So, how do you practice this kind of breathing? Start by finding a calm, comfortable place where you can sit with back support or lie down. Rest one hand on your chest and the other on your abdomen. Slowly breathe in through your nose over 4 seconds. As you do, feel your belly knot, your chest rise. Hold that breath gently for 2 seconds, then exhale slowly through your mouth over 6 seconds. Let your belly fall. That's one full round of diaphragmatic breathing. Repeat this breathing cycle for 5 to 10 minutes. You'll likely feel your pulse slow down, your shoulders drop, and your thoughts begin to settle. For best results, do this twice a day, once in the morning to start grounded and again in the evening to relax. If you feel anxious or disconnected before intimacy, even just 2 minutes of this can make a noticeable difference. In time, this habit supports your body's natural rhythm. More oxygen is delivered through your bloodstream. Your blood vessels become more responsive, and erections come more easily and last longer. You're no longer fighting your body, you're cooperating with it. I've worked with men who believed they were simply too old or beyond help. But once they made this practice part of their daily routine, they rediscovered spontaneous, natural erections. Just as importantly, they regained a sense of peace both with their partners and within themselves. Now, if something as basic as breathing can unlock such dramatic changes, imagine what happens when we apply a tool that actively pulls blood into the penis, retraining the body to function as it once did. The next technique is one of the most trusted tools in erectile recovery, and it's surprisingly simple to use. That brings us to method 3, vacuum erection therapy, or what I call blood flow re-education. I'll never forget introducing a vacuum pump to a patient in his mid-60s. He looked at me, half laughing and half confused. "You want me to do what with this thing?" I could see the doubt and even a little embarrassment. He had tried everything: pills, patience, even blaming himself. Nothing had worked. But 2 months later, he walked into my office with a completely different posture. "I'm getting real erections again," Doc used, "like I used to." That's the kind of transformation vacuum therapy can bring. Once you understand how this technique works, you'll realize it's not some gimmick. It's a practical tool for retraining your body to function the way it was always intended. As men get older, blood flow to the penis can gradually diminish. This can happen due to narrowed arteries, decreased physical activity, or conditions like diabetes and high blood pressure. When circulation isn't consistent, penile tissue loses strength and elasticity, making natural erections more difficult to maintain. That's where the vacuum erection device steps in. By creating gentle negative pressure, it draws blood into the penis, encouraging the blood vessels to expand and the tissue to stretch. It essentially mimics the physiological process of arousal, but in a way that's controlled and therapeutic. With regular use, circulation improves, and the body's natural erection mechanisms begin to re-engage. Using the device properly is key. Start by selecting a high-quality, medical-grade vacuum pump, either manual or battery-powered. The critical part is consistent, gentle suction. Apply a small amount of lubricant to the edge of the cylinder to help form a proper seal. Insert your penis into the tube, press the base firmly against your body, and slowly start pumping. Within moments, you'll feel blood being drawn into the penis, causing it to enlarge and firm up. It's important to understand, this isn't about arousal or stimulation. This is about retraining your body. Once an erection is achieved, maintain the vacuum for 10 to 15 minutes. Some men use a soft constriction ring to keep blood in the penis temporarily, but this should only be done under proper instruction. The goal is to safely boost blood flow, not create discomfort. Begin with this routine 3 times a week. Over time, some men progress to daily sessions, but always with care and never exceeding 30 minutes per session. In this case, more isn't better. Regularity is what drives the results. After a few weeks, many men report more frequent morning erections, improved performance with their partners, and heightened sensitivity. It's like waking up a part of the body that's been inactive for years. Unlike medication, this approach enhances the body's own erectile function, not just offering a temporary solution, but supporting long-term improvement. When combined with the first 2 methods, strengthening the pelvic floor and activating the nervous system through breathing vacuum therapy, helps re-establish blood flow. All 3 work together to reinforce different aspects of sexual function. For many of my patients, this combination is what finally creates real change after years of frustration. And we're still not finished. There's one last technique often overlooked, sometimes misunderstood, but backed by science that not only helps with stronger erections, but may even enhance length and overall tissue health. If this is new to you, don't worry. Most men haven't heard of it, but once you do, it might completely reshape how you view your body's potential. Let's dive into it. Method 4. The Penile Extender Protocol, the hidden power move. I remember clearly when an older gentleman, around 68, came into my office looking completely defeated. He had tried all medications, pumps, even exercises, but something still felt off. He looked at me and said, "Doc, I don't just want to function again. I want to feel like myself." That was the moment I introduced him to something completely new to him, the penile extender. At first, he was unsure. It sounded strange and maybe a bit too unconventional. But a few months later, after sticking with it consistently, he came back a changed man. His erections were stronger and lasted longer, and he even noticed a modest increase in length, something that gave him a powerful sense of rejuvenation. "I didn't think this was even possible at my age," he told me. But it was. And it still is for any man willing to commit to the process. Penile extenders aren't something most people talk about, yet they've been used in clinical settings for years, especially for patients recovering from surgery, trauma, or age-related sexual decline. The science behind them is simple but powerful. Gentle traction. When applied over time, This light, steady stretching encourages new cell growth, promotes better blood vessel development, a process called angiogenesis, and helps the tissue regain its flexibility, all vital for restoring erectile function. Using one isn't difficult, but technique matters. Begin by choosing a well-made, high-quality extender. Stay away from cheap, poorly built versions. They're often uncomfortable and ineffective. The best devices allow for adjustable tension, have proper support or padding at the tip, and are designed for long-term, safe wear. You'll start by attaching the device to your flaccid penis. It should fit securely without causing pain. The goal is a mild, comfortable stretch, not strain. Start with short sessions, about 30 to 60 minutes a day for the first week. As your body adjusts, gradually increase your usage to 1 or 2 hours daily. Most clinical protocols suggest continuing for a minimum of 3 to 6 months. This isn't an overnight solution. It's a commitment, but over time, you're reconditioning your penile tissue to be healthier, stronger, and more responsive. Plenty of men report improvements beyond stronger erections, like greater sensitivity, more confidence, and in some cases, visible gains in size. But the real benefit comes from consistency and patience. Think of it as rehabilitation for your sexual function. What sets this method apart is that it doesn't just restore physical performance, can also help with minor curvature, anxiety around sex, and the emotional toll that builds over years of decline. For many older men, using an extender helps them reconnect with a sense of autonomy over their bodies, something that often fades with age. And unlike short-term fixes like pills, the gains from consistent use can last. I've seen men not only recover their function, but also completely change how they view aging itself. It's no longer about keeping you, it's about taking back what they thought was gone. At this point, you've now discovered 4 key practices that restore your ability to achieve and maintain erections, from deep muscle training and nervous system reset to vascular recovery and tissue renewal. But don't head out just yet, because in the final moments, I'm going to show you how to bring everything together into a simple, actionable plan. Plus, I'll share one unexpected 7-second habit you can add to your day that could speed up your progress more than anything else I've seen. Let's close this strong. Over the past 30+ years as a urologist, one of the most important lessons I've learned is this: the most meaningful transformations don't usually happen with a prescription or inside a doctor's office. They happen when a man quietly makes the decision to take responsibility for his health, one small choice at a time. And if you're still reading, I know you're one of those men. We've gone over 4 specific strategies that, when practiced consistently, can completely change how you feel about connection, intimacy, and confidence. First, pelvic floor activation builds strength at the foundation, allowing better blood retention and stronger, more dependable erections. Second, diaphragmatic breathing helps reset your arousal system, easing anxiety and restoring proper blood flow to the pelvic region. Third, vacuum pump therapy reactivates erectile tissue that's been underused, boosting circulation and oxygen delivery more effectively than pills ever could. And fourth, the penile extender, while often overlooked, is a powerful long-term method for improving both function and confidence by physically conditioning the tissue. Yes, it may seem like a lot. 4 techniques, new routines, unfamiliar tools, but time and again, I've seen that men in their 60s and beyond are some of the most motivated and committed people I've worked with. Once they grasp the reason why, they don't hesitate to follow through on the how. That's when change really happens. These aren't just routines. They're messages to your body that you're not giving up, that you still want to enjoy life fully, love deeply, and take pride in who you are. Some men have told me they wish they had known about these approaches years earlier. Others have said it gave them a second shot at intimacy. A few have even told me it saved their relationship. I won't tell you these methods are magic. They won't fix every issue overnight. But what I can say is that they're safe, grounded in years of medical experience, and designed to help you reclaim your body without having to rely on medications or watch things slowly decline. You don't need to accept silent frustration or private disappointment as your new normal. You deserve to feel strong, clear-minded, and free to enjoy this phase of life without shame or limitation. And if you commit to just one of these practices today, you're already on the path toward real, lasting change. Thank you for allowing me to be part of this journey. I hope you'll continue, because what you gain won't just be stronger performance, could be an entirely renewed quality of life. Hi, ChatGPT.